So pertussis is a re-emergent disease in our days. We can see that is a trend of increasing of pertussis in worldwide, and not at all it's the same in the Republic of Moldova. So several pertussis outbreaks were detected in different administrative territories. So to have an overview about our immunization schedule, it's a whole cell pertussis vaccine included in a pentavalent. So we have a first dose at 2nd month, 4th month, and 6th, and the 4th dose at 2 years age. So objectives of the study were to describe pertussis epidemiological situation and to analyze pertussis morbidity and vaccination coverage. And of course to develop recommendations in order to improve surveillance and control of pertussis. This is a retrospective descriptive study. The data were collected from national surveillance system. All the study population were persons who were confirmed by national case definition. Were analyzed 210 from 283 cases due to a lack of data for 73 cases. So the clinical confirmed case is a person with a cough lasting at least 2 weeks with at least one of the following symptoms: paroxysm of coughing, inspiratory whooping, and post-tussis or coughing vomiting. A log confirmed is isolation of Bordetella pertussis by ELISA or PCR, and epidemiological confirmed is a case that meets the clinical case definition and it's linked to a laboratory confirmed case. In 2016, we registered 283 cases with an incidence per 7 person per 100,000 population. Were affected 18 administrative territories who notified at least one case. The vaccination coverage decreased from 2008 to 2015 from 95.4 to 89%, and we can see in this graph that with the vaccination coverage, which is obvious, with a decreasing, it's an increasing of incidence. So the whole distribution of pertussis cases among age groups, we can see that the most affected groups are the children under 2 years, which represented more than 40%. And we can see that the children school-aged and adults representing 30% of the cases. One of our objectives is to see which were the application of medical care, and we assessed that there is a late application, in average with 10 days after the onset of a disease. And for the age group under 1 year, it was 9.6 days, and we can see that with the increasing of the age group, we are having a late uptake. So for 1 to 6, it's 11 days, and for over than 7 years and adults, we are having 13 days till they are receiving the treatment. So between the date of treatment and initial diagnosis, we see that the first week after treatment are having in 57%, and to have the diagnosis is after the second week and later are in 42%. So this is our distribution of pertussis cases by confirmation method. We can see that 73% were confirmed by laboratory, 16 were confirmed epidemiological, and 10% of them were represented by clinical data. One of the, to say, alarming things were that more than 50% of the cases didn't have been diagnosed from the beginning with pertussis. So only 40% of cases were diagnosed from the beginning with pertussis, and then with other diseases like pneumonia, SARS, and others. So this is showing and the vigilance of doctors among pertussis. We can see here so that more than 50% of the cases had contraindication, refusals, or no vaccination data, which is quite not so well representing in a protective factor. And we can see that the fourth dose of vaccine, who received 4 doses of vaccine were represented by 30%. Maybe here is we can speak about vaccine effectiveness, but we have to conduct another study to see which are the reasons. So for sick children who receive a full vaccination against pertussis, 25% of them were vaccinated 1-2 years ago, and 25% of them were vaccinated 3-4 years after immunization. So the most false contraindication, which are not recognized by WHO and our institution is, and they are classified like false one, are like hemangioma, anemia, congenital glaucoma, and so on, representing more than 70%. And we can see that vaccine hesitance now is growing up and growing, and we have refusal from vaccination in 21%, especially in the children under the age of 2 years, which represented 71% of refusals of vaccination. So the age group of pertussis patient is dominated by child age mainly up to 2 years. School-age children and adults are also involved in the epidemic process. It was observed a late take of medical care and diagnosis which can lead to the spread of pertussis infection. And the unvaccinated children take a significant place due to false contraindications or to refusals of vaccination. Adolescents and adults may become a significant source of infection for unvaccinated or partially immunized newborns. For recommendation, we are going to implement new communication strategy to increase vaccination coverage and to stop the vaccine hesitance, to increase the vigilance of healthcare workers for rapid detection with proper diagnosis and timely treatment, to train healthcare workers on true vaccine contraindication, and to revise existing protocols. And additional studies are needed to assess the effectiveness of a current vaccination schedule. Thank you for your attention, and thank you for the team who were with me and we had this study conducted. Thank you.
Thank you very much, Alexei, for this very comprehensive presentation, for keeping the time, which leave time for questions. So please, if you have any question, comments.
I wonder if there is a penalty for the parents to pay if they are not vaccinating their children. And also I wonder, there is no pertussis vaccination for children more than 18 months in Egypt, just diphtheria tetanus as a booster dose. And pertussis is not included for children more than 18 months. Is it applied in your country or not? Thank you.
Thank you for the question. Taking in account the penalties which are now growing, to say in France, Australia, Egypt, we don't have the same. We are having only mandatory vaccination for the children who are enrolled at the kindergarten and at the school. But it can be interpreted in more kinds of ways due to the legal issues. We are having now some disputes to have maybe not to go to the penalties, maybe to go to open the heart of a person, so to leave a little bit of space that parents could increase the credibility in us about vaccination. So we are having now the same situation in Romania, which are implementing now the penalties for unvaccinated. So the reaction of the population is really not so well accepted. And now we are growing in other days where it's more democratic. So the balance is very, very thin. So we can have here a discussion of 2 or a couple of days. And yes, we don't have any penalties. For the second question, we took in account the WHO position paper for pertussis, which is meaning that we can have pertussis vaccinated with whole cell pertussis till the age of 4 years. And we select to have the booster dose at 2 years because it was showed in literature review that vaccine effectiveness of DTP or whole cell pertussis after vaccinated in the third dose of 6 months until 2 years, it's effective, and it was our choice to have this one in the national schedule. Thank you.
Any other question? Nada?
Thank you, Alex, for very interesting investigation, and everything was given very clearly, your presentation. Now, I have one comment only. According among your results, I see that less than 50% of cases were diagnosed, the first diagnosis was not pertussis. And what do you think about, maybe you include among recommendations some kind of education of physicians in terms of early diagnosis of pertussis? Thank you.
Thank you, Nana. We conducted now several of trainings, and we are planning to conduct new ones and to be more updated and to increase, this is the question, to increase the vigilance of the doctors about pertussis, because more of them didn't see pertussis for a couple of years. We had some cases from 2004 to 2010 or 12 even, it's were registered only 20 cases, 15 cases. So not all the administrative territories and doctors could see this pertussis. And now there are diagnoses like pneumonia, and having a 2 weeks waiting, then to see, oh, I can give a sample for pertussis, which is obvious that you are having a very special cough with, after coughing you are having the vomiting or paroxysm, which is very obvious, but this is the true situation, and we will try to increase the vigilance. This is my comment. Thank you.
From the my co-chair, Dr. Samir.
Thank you, Alex, and welcome you in the influenza session by the microbiological pertussis. And actually, I wonder if these cases that you are taking from the surveillance are clustered in different areas, or it's sporadic cases regarding to the nationwide. And the other issue is the process of vaccination. Is the process of vaccination regarding to the vaccination process, the safety of the vaccine, the efficacy of the vaccine are not well established in your country to present these epidemics in pertussis, which is the vaccine preventable diseases, and the ABI all over the world is a mature system, especially in Europe.
Yeah. Thank you, Dr. Samir. So let's take from the beginning with about the clusters. So we are having now more clusters in 2 municipalities. We conducted now a case control study at the first phase, which we enrolled, all the cases were more in the capital, more than 70% of them. So yes, they are clustered, and maybe here is an issue to detect these cases, because it's only in 2 municipalities where the doctors are very high qualified, and they are having already, this is like something routine to detect, and they're only seeing and having the pertussis diagnosis. Again, we, like I said, we conducted the case control study on the first phase, and have seen that more of the children were clustered in some neighborhoods or having the same school, where the risk We didn't take like from the case definition where it seems that cough to have at least 2 weeks. We had it in the in like a variable cough more than 1 week. So the risk to have the children very closely to a person who is coughing more than 1 week, it was seven times much higher than those who weren't exposed. Thank you.